It's a plan that was debated for more than 50 hours and that, by the way, includes 160 Republican amendments, a hopeful sign of bipartisan support for the final product if people are serious about bipartisanship.
The president just moments ago hopeful that his new health care bill will be passed by Congress, urging lawmakers to take action. So will Republicans be on board with the plan? For that, we go to Capitol Hill, where we're joined by Representative Dave Camp. He is the ranking Republican on the House Ways and Means Committee. Thanks for joining us.
Thank you.
So, Democrats released their plan yesterday, raising taxes on households earning more than $350,000 a year. Is that something Republicans would support?
Well, I think there's a couple of problems. First, they're rushing this bill through the Congress. It was just introduced yesterday, as you pointed out. We're going to be voting in committee tomorrow on this thing. The Congressional Budget Office, which is the nonpartisan expert entity that analyzes our legislation, hasn't even been able to complete their analysis of the bill. So not only are we rushing to read the bill, we don't even have the benefit of expert legal advice on terms of what the bill is going to cost, what effect these costs will have on the amount of people who will be insured, how many small businesses may lose health insurance, what this impact may be on families. And so there are massive spending items in this bill, massive tax increases in this bill, and we don't even know exactly what that's going to mean for Americans. I think we should slow this down and work next week, have an opportunity this week to read the bill. And the more important part is there is a major government takeover of the healthcare system that you're going to see with this public plan. People lose their private insurance, and the government is going to get in the middle of you and your physician making your medical decisions. They create a health choices commissioner, which will have ultimate power to virtually decide anything they want to, not only on what benefits your insurance can have, but the whole what providers may get care, be able to provide care under this bill. So there's a lot of unanswered questions. It's a very complex structure that they've created that I think has the chance of doing more harm than good.
Now, one of the concerns you brought up was the impact on the business community. What kind of impact do you think it's going to have?
Well, if you take their analysis from the Joint Economic Committee, Dr. Christina Romer, and you put in the employer mandate, the 8% that they put in the bill, they estimate we could lose as many as 5 million jobs. The little bit of analysis we've gotten from the Congressional Budget Office says that any costs on employers will immediately be paid by employees, either in terms of lower wages or job loss altogether. So they actually admit that these costs on employers will be transferred to individuals, to citizens, to their workers immediately. That will be passed along. So I think that is a very troubling aspect of their bill, this sort of player pay or employer mandate, 8% tax for employers who don't offer insurance.
But can't you argue that skyrocketing costs of health care pose an even bigger risk?
Well, they do, and that's why we as Republicans think that you ought to get the costs out of health care. What they've done is created a massive spending bill that then they have to raise taxes to try to cover the spending in this. We're proposing get the costs out of health care. Look, they don't ever talk about liability reform. We know that that's hundreds of billions of dollars a year in duplication, in defensive medicine. They don't have anything in there to really have administrative changes so that individuals and small businesses can actually benefit from the kind of pooling of employees in risk that large companies get to do. And lastly, they don't do anything about waste and fraud. There's recent polling that indicates the American people think that attacking waste in Medicare is actually the first thing we ought to do before we go to the American people and ask for higher costs, higher taxes.
So you think one thing to do is to slow this bill down, but President Obama urging lawmakers to pass it before the August recess. Do you think that's possible?
Well, you could still delay the markup a week and have an opportunity to actually read the bill, have an opportunity to actually get the expert advice and feedback on the bill that I think the American people deserve. This isn't about the committee. This is about, do the American people have the benefit of knowing what this legislation may or may not mean to them and their families and to their employers and to the small businesses that they may work in? That's the issue, and I think this is moving way too quickly. They're jamming this through just as they did the stimulus bill, hoping people don't really understand what's in it. And they'll say, oh, gee, it sounds great. The government's going to provide my health care. But ultimately, there are tremendous costs. There's going to be cost shifting. There's going to be job loss. There are going to be. We need to know what the downsides are going to be. And like I said, as Republicans, we'd like to see a step where you get the costs out of health care first, then go back and see what else do we need to do to insure more people.
Okay, our thanks to Congressman Dave Camp, ranking Republican on the House Ways and Means Committee. Appreciate your talking to us.